Hi everyone, this is Dr. Bell, and in this presentation we're going to talk about reversing diabetes and how you can lower your glucose numbers. So if you were wondering if diabetes is a healthcare crisis, I would argue that it is. 10 years ago, about 6% of the US population suffered from diabetes. That number is now 10.5%, or 1 in 10 people suffers from type 2 diabetes. About 7.3 million people are undiagnosed, which means they're walking around and they have no idea that they're diabetic. 88 million adults are pre-diabetic, and 90 to 95% of people that suffer from diabetes are suffer from type 2 diabetes. And this also is something that has to do a lot with lifestyle choices, being overweight. The United States has one of the highest rates of obesity in our population. And so these are all things that can lead to declining health in a population. And then the other scary thing is that diabetes used to be called adult onset diabetes, which they no longer call it that because there's so many adolescent and young adults that are getting diabetes as well. Statistically, it looks like it's only going to get worse. In 1985, there was approximately 30 million people globally that suffered from type 2 diabetes. In the year 2000, that number had jumped to 150 million. And by the year 2030, the worldwide number of diabetics is going to be predicted to be right around 500 million. So is Western medicine to blame? I don't know. But what I do know is in Western medicine, the first thing that is always considered is what disease do you have or what condition are you suffering from, and what drugs do we need to give you so we can cover up or reduce the symptoms of that medical condition. And this is where billions of dollars are spent every year to make you feel like this is the right approach. And what really is the scary thing, I guess, or the way that diabetes is treated, along with thyroid issues and hormonal issues, is it's considered a lifetime disease. And so that also means prescription drugs for life. And this leads us to diabetic myth number one, and that is that diabetes gets worse over time. But what we want you to know is that diabetes doesn't have to get worse over time. We know that the best strategy is to prevent it from happening in the first place, but with the right plan of action, a diagnosis of diabetes is not a guarantee that it will worsen. You do have to make some changes, and with any serious medical condition, if it's not properly addressed, then it is going to get worse over time. But you don't have to follow a conventional medicine approach, and that is that as you get older, you have to take more and more medications and inject yourself with insulin. The CDC states that diabetes is controllable. They also state that diabetes is reversible, but there currently is no cure for diabetes, but it's possible to put diabetes into remission. But remember that if you do fall back into your old habits, then you can just as easily become a diabetic again. So the scary thing about diabetes is there's no obvious symptoms. There might be some things that are noticeable, but having diabetes isn't something that you necessarily feel. It's usually discovered on a blood test or through some sort of a routine physical screening. But if you want to know some of the risk factors that could possibly indicate a risk for diabetes, the most obvious one is going to be being overweight or suffering from obesity. Typically, the age of 45 years is considered where the risk factors tend to start as our bodies start to age. Of course, if you're not physically active, then you're not burning calories and you're not doing things that would keep your body healthy with circulation, things like that. Culturally, African American, Hispanic, or Latino, and American Indian cultures and heritage seem to have a higher prevalence of diabetes compared to other cultures. And also, if you eat what's called a standard American diet, or the SAD diet, that's a diet that's high in vegetable oils, high in fat, low in vegetable consumption, and high carbohydrate, as well as like a fast food type diet. Clinically, though, what usually will bring someone to the doctor is they're urinating a lot, or they complain of thirst even though they're drinking 8 to 10 glasses of water a day. Doesn't matter what they eat, they're constantly hungry. Maybe their vision is blurred, or now even some of the optometrists have a machine where they can look at the retina in the back of the eye. They can take a look at the blood vessels, and there's a way to see if there's a risk factor for diabetes, because vision is one of the issues that you can have, vision loss actually from being a type 2 diabetic. In our clinic especially, numb feet or neuropathy is another symptom of diabetes. It's for neuropathy, diabetes is actually the #1 cause, which we'll talk about in a minute. Dry skin is another indicator, or having sores that don't heal very quickly. So in reversing diabetes, it's important to know the numbers, and that's how the treatments are usually geared, or the protocols, or however you're going to look at your situation if you're a type 2 diabetic. Generally, when your hemoglobin A1C goes above 6.5, then that's going to give you the diagnosis of diabetes. But you can also have high fasting blood glucose and what's considered a fairly normal A1C. So if your fasting blood glucose is higher than 126, then that's also an indicator that you might have type 2 diabetes. But to put diabetes into remission, your labs have to remain in a certain range, and that range needs to be between 4.0 and 5.6. Your fasting blood glucose must also be between 65 and 99. And we'll talk about some optimal ranges here in a second, but you do need to have your blood sugar under control and your A1C under control within laboratory range to be considered a non-diabetic. So diabetes develops as a result of hormonal imbalances. Insulin, which is a hormone, is produced in the pancreas. And when you have diabetes, your cells are resistant to insulin. And what insulin actually does is it is like the key to a door, and it helps transport the glucose into the cell. The cells can only take so much glucose, and when we have an overconsumption of carbohydrates, or sometimes even overconsumption of protein, then there's too much glucose than we actually need. And so the cells aren't going to take on any more glucose. The liver, which stores some glucose, is probably already full as well. And so this is when blood glucose numbers start to rise, or we start to get glucose building up in the blood. This is toxic to our bodies. And so what happens is we get an issue where the body has to get rid of the toxicity, and the way that it does that is it stores sugar as fat. And this is why obesity and diabetes are so closely related. And this is a huge amount of hormones, and several different hormones actually, and our body makes an attempt constantly to enact fat burning hormones and to enact fat storing hormones to maintain what's called homeostasis, or a balance in our body. But our hormone supply isn't limitless or endless. And so if we do push this to the limit, which is typically what's happened in somebody that gets diagnosed as a type 2 diabetic, then we start to get some pretty major hormone imbalances. And so some of the hormones that can be affected for fat burning can be human growth hormone, or HGH, insulin-like growth factor, glucagon, thyroid hormones, and testosterone. Your fat storing hormones are insulin, estrogen, and cortisol. So these all have to maintain this delicate balance in our systems. And if this does get out of balance, then it does take some time for us to get these hormones back under control for you, so we can start to lower those blood glucose numbers. Diabetic myth number 2 is that I have diabetes and I'm just going to have to live with it. But what I would want all of our patients to remember is that your lifestyle can almost always trump genetics in most cases, unless you're a type 1 diabetic. And there are some research studies that have shown that there is a small genetic component, but typically there's an illness or some sort of a disease or an autoimmune issue that has caused the pancreas to stop producing insulin. And that's generally what a type 1 diabetic has to deal with. Conventional medicine believes there's more of a genetic component to type 2 diabetes, but it's not what you think. The reason I say that is because genetics probably do play a role, And like we just talked about a second ago with hormonal imbalances, our bodies are sugar storage machines. And like we talked about, when there's excess sugar, we store it as fat. So really, every human being is genetically predisposed to diabetes. And this isn't just unique to one person or one group of people. The reason I say that it's genetic in this way is because it is familial, but in this familial sense, what I mean is that families tend to eat together. They tend to eat the same meals. They tend to eat the same habits. It could even be cultural habits that have been passed down from generations. So if the entire family eats pizza, soda, spaghetti, and fast food every day, then eventually that family is probably going to be overweight. Family is probably going to suffer from obesity. And then because we do have the genetics for diabetes, then it could run in the family, as the saying goes. But really what the reality is the lifestyle is actually contributing to the genetics, and they're just eating horribly. So if you clean up the diet, typically that's the general belief with diabetes, is it's a diet related issue. So if you clean up your lifestyle, clean up your diet, then that's why it's possible that you can reverse diabetes. Myth number 3 is that as long as I take my meds, I'll be fine. But what happens with most diabetics, or at least the diabetics that we see in the office, is over time they've ended up having to take more and more medication because their sugar numbers keep climbing higher and higher. The main reason this happens is because the insulin sensitivity continues to persist and gets worse, and so sugar continues to build up, and then eventually the pancreas can't keep up with the level of sugar, and so most diabetics end up on insulin if they don't make the necessary diet or lifestyle changes, which is what also allows the problem to persist. And then patients can become resistant to medications, and so the medications themselves can stop working. So it's kind of a vicious cycle, and something that can be very, very frustrating for patients when they're dealing with diabetes. So we've mentioned several times about diabetes and weight gain or obesity, and it's the same theme we've been talking about, and it's that our bodies are programmed to store sugar as fat. Excess sugar is toxic, so your body has to eliminate the toxicities to keep you alive, or in an effort to keep you alive. And so those excess sugar molecules get stored in fat cells as a protective mechanism. Most people try to reduce their fat consumption, and they struggle to lower their blood sugar and lose weight, or they will complain that, I just look at food and I gain weight. And usually it's because there's not a great alteration in the carbohydrate intake, which allows the insulin sensitivity to continue. And so until you get the insulin sensitivity under control, then it's going to be very difficult to lose weight. So we mentioned neuropathy being one of the symptoms of diabetes, and there are a few factors at play here. And the number one cause actually of peripheral neuropathy is type 2 diabetes. The key to reducing the painful burning and tingling that patients experience when they suffer from neuropathy is to increase the amount of oxygen that's flowing to the feet. And the way that this is done is by lowering blood glucose. The oxygen and sugar molecules take up the same space on the red blood cell. And so when we have high blood glucose, we will have lower oxygen. So by lowering blood glucose, we can eventually get the oxygen levels up, and that's what helps patients reduce the symptoms of neuropathy. Another factor with neuropathy is having high cholesterol and triglycerides. And this is one of the risk factors we talked about as well with diabetes, is having high cholesterol and high triglycerides. This usually will result in a patient being on what's called a statin medication, and that's the number 2 leading cause of neuropathy, is taking a statin drug or a cholesterol lowering drug, because the nerve is actually lined with cholesterol. If you strip that away, then that allows the nerves to essentially short circuit themselves, and they start to get shock-like pains and stinging pains, because there's literally no covering on the nerve, because that covering on the nerve is actually made from fat. The number 3 cause of neuropathy is low back disc problems like degenerative disc disease, and also osteoarthritis. And this is also a very common condition in diabetics. So these three complications can all be intertwined, intermingled with each other, but generally we see neuropathy as probably being one of the most common symptoms that patients complain about when they become diabetic and live with diabetes for several years. Another complication of diabetes is peripheral vascular disease or peripheral arterial disease. And the high level of blood glucose causes the blood vessel walls to weaken. It can cause the blood vessel walls to collapse. There's also a loss of oxygen typically, which will also cause weakening of the blood vessel walls, and also inflammation from all of this as well can weaken the arterial walls. And so what happens is the blood flow is reduced, the unoxygenated blood tends to pool in the extremities, and we get swelling, you get discoloration. Certainly it's painful. It can also be dangerous too because it does increase the risk factors for heart attack and stroke. And that leads us to our next complication of diabetes, which is heart attack and stroke. High cholesterol, high blood pressure, and vascular disease, those are risk factors for diabetes. They also happen to be the same risk factors for heart attacks and strokes. That's why they also call heart attacks and strokes the silent killers, because you don't necessarily feel them until they're coming on. But you do have an increased risk of heart attack and stroke when you are also a type 2 diabetic. Eye disease in general is common in our society, but you're more susceptible to eye disease if you are pre-diabetic or diabetic. Some of the conditions that are more common are retinopathy, macular edema, cataracts, and glaucoma. High blood glucose can damage the blood vessels in the back of the eye, which can lead to these conditions. So if you are pre-diabetic or diabetic, it's very important that you have your eyes checked at least regularly and make sure that you have your A1C, blood glucose, blood pressure, and cholesterol under control, because this is the best way to prevent diabetic eye disease. Diabetes can place incredible burdens on families. Some people, if the disease gets really bad, they require a caregiver, but often that caregiving falls back on a spouse or even the kids. But it also prevents families from enjoying time together, like on vacations or even just going to simple events like a graduation for a grandchild. If you get neuropathy, for example, it becomes very painful to walk, and that's usually one of the most common complications of diabetes. So it becomes hard to do simple tasks around the house. It becomes hard to even just get up sometimes and get out of bed in the morning because your feet are burning so bad. But we've heard countless stories of patients that come in, and that's one of the reasons they're motivated to come see us, is because they're missing out on a graduation, or they just stay in a hotel room or inside the cabin on the cruise that they went on because they couldn't stand, they couldn't walk, and they couldn't do the things that they wanted to do. And also, if this does lead to an unfortunate heart attack or a stroke, sometimes the recovery is years, even months, or you may never recover at all, which can place even larger burdens on families. Diabetes cuts the life expectancy on average about 13 years, with men being affected more than women. Also, the younger you get diabetes, the greater the chances are that you'll suffer from loss of life. 2019, diabetes was the 7th leading cause of death, and it accounted for 87,640 deaths. But as we've talked about, diabetes is preventable and it is a reversible disease. So we feel it's very important that we take the steps to educate patients in how to do this naturally and safely without just taking drugs to reduce or manage the symptoms. All right, so we've talked several times about how diabetes is essentially an insulin problem. And remember that insulin is what regulates blood glucose, and that's what helps it get into the cells. The foods you eat, mainly carbohydrates and proteins, those are broken down into sugar. And when this happens, insulin is the signal to the liver to store sugar for later use. And insulin will also help transport sugar into the cells for storage and use as energy. But what happens if the liver and the cells become full of glucose? It starts to build up in the bloodstream, and the normal level of insulin now is not able to move glucose where it needs to go. So the pancreas responds by making even more insulin. But insulin really isn't the problem. More insulin isn't going to solve the problem because the cells are already overfilled, and so you can't cram more glucose into the cell, kind of like if you think of a bus or a train and it's packed with passengers and there's no more seats left, you can't actually put more people onto the train. So at some point, adding more insulin isn't going to get more insulin into the cells, and this is when you start to become a type 2 diabetic. This also may help to explain why medication may not be the best answer, but yes, the medication will temporarily reduce blood sugar, and the sugar numbers will come down because glucose is being artificially forced into the cells, just like if we were forcing people to stand in the aisles on the bus and people were hanging off of the bus. Even though there's not enough room for people to sit, which would be glucose, then we are able to temporarily cram more in there. But as the sugar builds up, it's going to take more and more medication to keep stuffing glucose into the cells. But since more insulin doesn't solve the problem, this is the reason why medication needs to increase over time. Really, the trick with defending against diabetes is to figure out a way to burn off the stored glucose, because again, it's not necessarily a glucose problem, it's a problem of having too much glucose stored inside of the cells and inside of the liver. So doing things like reducing the carbohydrate intake, as well as doing other things like exercising and figuring out ways to burn the glucose, is really the best defense against diabetes. So one of the ways that you get diagnosed, either accidentally or there's some suspicion that something might be going on, is by running lab tests. And very commonly in traditional medicine, the labs are going to come back as normal, or the labs will not indicate that there's something clinically going on. And especially in terms of things like thyroid issues or digestive issues, they don't typically show up as being clinical problems on labs. Now, we've already talked about the A1C and glucose numbers showing up, and those are very easy to see on a laboratory test. But what happens is there's not a lot of attention given to a potential diabetic patient when they're in a pre-diabetic stage, or even when their blood glucose numbers are, say, at 102 or 103. So those would be normal labs. Nobody would pay much attention to that, and the problem would continue until such time that the numbers go above 120 on blood sugar, or A1C goes above 6.5. And just remember, just because your labs are normal, there still can be problems there, and these are called subclinical issues. So in functional medicine, we only pay some attention to the normal ranges that show up on a test from the local lab. Those are actually the parameters for a large portion of the population. And this is why your doctor might have told you in the past, like, oh, things are normal, but you're like, well, I don't know why I'm feeling so bad then if things are normal. But if you look at the diagram here, you can see that the functional lab range is a more narrow range inside the actual lab range. So you can still be normal on labs, but not normal in terms of a functional lab test. Now, if things are outside of the lab range, then that's where it's a little too late. But where we want to actually be discovering sickness or the potential for disease is when things go outside of the functional lab ranges. And this is in most cases where you're going to get the help that you need, is by paying attention to these functional ranges. So in functional medicine, we are not in the practice of searching for diseases, looking for diseases, or even treating diseases. We're mainly concerned with the underlying root causes of what can be affecting your health. So there's four main things we look at, and the first is physical, second would be emotional, third would be chemical, and the fourth would be things that affect your immune system. Physical things would be, of course, you can imagine car accidents, sports injuries, slips, trips, and falls, stuff that's physically happened to your body. Emotional stressors are varied. This can be, trouble with family members, trouble with your spouse or loved one. It could be work stress. It could be things going on social media. There's all kinds of different emotional stresses that we see. But this can cause different things to react in your body, and we can actually see those on lab tests, believe it or not. Chemical, you can imagine, could be from food, it could be from drugs, it could be from environmental things, exposure to glyphosates, Roundup, those types of things. And so there's all kinds of chemical issues that we know can affect health. And then, of course, your immune system, which determines your overall level of health and your ability to resist or fight off sickness and disease. And so we want to make sure that your immune system is functioning as best as it can, so it can help you fight off diseases and to stay healthy. So we've been helping patients that suffer from high blood glucose numbers for about 8, almost 9 years now. And the one thing that patients will commonly say to us is, I know there's got to be a better way out there. You helped my friend do this, and they've been able to reduce their medication, or they're completely off insulin now. So I want to know what you do. And that's really what we do here is we don't treat diabetics. We just help, again, help patients discover the underlying cause of blood sugar problems. But the lab tests can reveal some things that could give us some more clues as to what might be the problem. And maybe it's not a glucose problem. Maybe there's a liver problem or a thyroid problem or a hormonal problem like we already talked about. So again, there can always be other causes, not just blood sugar issues. And then, of course, as we've talked about, medication doesn't always provide the right answer for certain patients, and some patients don't like the way they feel on medications. And so we have ways that we can help patients balance blood sugar without drugs and without insulin. So our practice is called Vitality Integrative Wellness. And the reason we named our practice that is because that's the approach we take with patients. We take an integrative approach, which combines Western medical treatments and medical therapies with alternative as well as Eastern medical philosophies. And what this does is this allows patients to be proactive with their health and not reactive to their health. This puts the patient in control of their health, and it also helps us educate patients to learn to listen to their body and to learn to, again, take control of those things that they need to improve their health. We seek to find the root cause of your health, and we want you to function in a way that you no longer have to treat symptoms or at least approach your health care from the attitude that I am going to wait until I have a symptom to do something about it. So we have a process called the blood sugar transformation process, and it's really quite simple. It's nothing complicated, but what we start with is we use diagnostic testing that can identify the causes of abnormal blood sugar. We'll then take a look at your digestive health, your nutrition, your hormones, look at exercise, how much you do or don't exercise, and then also look at your brain health as well. We'll then have a plan to administer the correct supplements that help unlock healing. And as we go through our coaching and lifestyle program, this is what's going to allow you to help attain the long-term health that we seek for all of our patients. So if your sugar numbers are too high, or your doctor's telling you that your A1C is at a dangerous level, then there are solutions that you can take to reverse that and to get your numbers heading in the right direction. We would love to have you book a consultation with our office so we can explain to you our natural approach in better detail. So please give our new patient coordinator a call at 951-225-4419. And also, many people suffer from abnormal blood glucose numbers or high A1C. So if your spouse, your friends, or family members are also suffering from these types of issues, we certainly would love to talk to them as well. You can check us out on the web at www.growwithvitality.com. And we're also on social media on Facebook and Instagram at Vitality Integrative Wellness. So that's it today for our presentation on lowering your blood glucose numbers, and we look forward to seeing you in the office very soon.